reflexology and what an imbalance is in the body. So an imbalance is when we're balanced, everything is at ease in our body. Okay. When we're imbalanced, it can show up sometimes in the form of stress. It can show up in terms of an illness or a chronic disorder. So, for example, maybe irritable bowel syndrome or migraine or PMS, or anxiety as well. Okay, when our body isn't balanced. And also, all of that affects our sleep as well. And we know that sleep is really, really important for the body. It gives us time to rest and restore, and it also gives the body time to heal. So, if that's disrupted, then the self-healing that the body can do itself just when it's asleep, that's disrupted as well. So this routine is actually great for helping with sleep as well. We're going to be working on one of the glands called the pineal gland, and I will be showing you this, but it's located here in the big toe. And it depends, sometimes when you look at different reflexology charts, it might be on the toe pad, it can be on the front of the toe. On this little model that I have, it's just here. But the principle is, if you're working the big toe, you're going to be working the pineal gland. And the pineal gland is really important because that's the gland that secretes the hormone melatonin. And melatonin is what helps us sleep. Okay, so this is a really good one to be able to do. And the basic principle when we come to looking at the feet and reflexology is that the left-hand side of our body is represented on our left foot and the right-hand side of our body is represented on the right foot. Okay? I hope everyone's okay with that, just as a brief introduction to reflexology. Obviously, there's lots more history and different things that we can talk about, but just as a brief overview, let's just think about it in terms of our feet. I'm showing you my hands now, but it's the same for the hands. Every single part of your body, every organ, every system, every limb can be mapped onto your foot. So it's amazing to be able to work the feet and think we're working the entire body. That's really amazing. And that's why reflexology is such a powerful treatment. It's really gentle, but it's very powerful as well, okay? And for anybody that hasn't had reflexology before, or even for people that have, you'll know that sometimes after a reflexology treatment, you can feel absolutely exhausted, like really, really exhausted. And the reason for that is because maybe you haven't had some self-care in a while, or maybe this is your first time to have a treatment, but your whole body is relaxing, and that might be new for your body. So the body just needs a little bit of time to adjust to that, and you can feel exhausted from that. And plus, we're working every part of the body, okay? So it's only natural. If you think about, if you went for a full body massage, you would come out afterwards thinking, oh God, I'm so tired after that. But it's the same with reflexology because we're working the entire feet. And for anybody that is a reflexologist on this call today, you'll know that there have been times when you've been practicing reflexology on somebody, and within a couple of minutes, they can just be gone. They're fast asleep, and that's great. Their body is in full relaxation then, okay? So let's just remember that as well when we're going to be working with a toddler or a child, that this might be their first time to have reflexology, okay? So we want to work very gently and we want to work very lightly, okay? So this is just an example of a foot chart that I use when I'm teaching, okay? So as you can see here up in the toes, we have so many reflexes in our toes. It's absolutely amazing, especially for children, okay? Because their feet are small, so we can cover lots when we work on a child's foot. But just in the toes alone, we have the head, we have the brain, we have the sinuses, we have the teeth. So any little babies or grandchildren teething, really great to work the teeth. We have the pineal gland, which I was showing you for sleep, brilliant. And the cranial nerves, okay, which are part of our central nervous system. They're in the brain. We've 12 craniosacral nerves that they're responsible for our motor and sensory functions. So really, really great for working on them for a baby or for a child as they develop, okay? I don't know if any of you are familiar with craniosacral therapy, or if you've had that before, or if your grandkids or children have had it before, but craniosacral therapy will be working on those nerves that control your motor and your sensory functions. Okay. Then when we move down just under the toes here, we have the reflex for the eyes and the ears. Okay. And then if we come down another little bit here, this is our lungs and our chest area. This little star represents the solar plexus, which is a tight network of nerves that sits on the diaphragm. And this is a really, really good one to know for relaxation and for if you're feeling stressed or if you're feeling anxious. And I'm going to be showing you all this one for yourselves on your hand so that you can do this along with some deep breathing. Okay, this is a really good one to know. And if you've ever had that feeling before where you think, you know, oh, I feel sick to my stomach, or I'm sick with the nerves, that's what that is. That's the cranial, that's your solar plexus, okay? Because they're sitting right on your diaphragm, right in the abdomen area, okay? So then we move down and we have the upper abdominal area. So this would be across both feet, and it would cover your liver, your pancreas, your stomach, your gallbladder. So really important in terms of digestion, okay? So this is a good one to work if you've got any little toddlers or kiddies that have issues with constipation or wind. This is a very good one. And the lower abdominal area there is our small and large intestines. Again, a really good reflex point for the digestive system. And then we have our pelvic area down here in the heel. And all along the inside edge of the foot, this purple line here is just to represent the spinal reflex. Okay, let me just go back there. The spinal reflex just along here. Okay, and we're going to be working that one. That's a really important one in terms of relaxation. Okay, really important, because the spinal cord has so many nerves running through it. The brain and the spinal cord are our central nervous system. We're going to be working both of these today. So when we work those, we are working the entire central nervous system that is in our body. When we do that, we're calming, we're soothing, we're grounding, okay? So lovely one to do for anyone that has worries or stress or tension, okay? So let's have a little look at the benefits then of reflexology for babies, toddlers, and children, okay? So it's really great for promoting bonding, whether that's with mum or dad or a carer or a grandparent. It's a lovely way. It's a nice quiet time for both of you to just sit down and to be still. Now, in saying that, I do it on my little girl sometimes, and she could be watching a cartoon, okay? She's the feet up on my lap, and I'm doing some reflexology on her. It just depends, but you're still bonding. It's still connection between you and the child, and it's in a very comforting way. So that's really nice, okay? So for children, then it's very calming, it's very soothing, and also, most importantly, it's reassuring because it's touch, and it's gentle touch. It's comforting touch. So that's very reassuring for a child. It also helps to boost our immune system, because when we work with reflexology, we're working all the different points in our body. We're stimulating lots of different organs and limbs and systems within the body, which is great. It's getting our blood flow going, and we're also going to we also work the lymphatic system when we do reflexology as well. So that's very important for our immune system. And also sleep. We're going to be looking at sleep as well. If you've good sleep, then that really helps your immune system as well. It's as I was saying there when we were looking at the diagram of the foot, it's great for digestive ailments as well. So colic, reflux, constipation, wind, any issues with the tummy, it's really great for that as well. It promotes balance and harmony. So where I was talking before a little bit about imbalance in the body, it just helps to bring the body back to what we call homeostasis, which is balance. When we're feeling good, when we're feeling okay, when we're feeling healthy, that's balance, okay? And in the mind and the body as well. And it's a great pain reliever. So for children with growing pains or teething with little babies and toddlers, it can really help with that as well. So let's have a little look at when we shouldn't do reflexology on a child, okay? Because it's important to know that. So if your child has a fever, we're not going to do reflexology on them, okay? We need to give their body some time to regulate and to balance itself before we go in there and do reflexology. Don't want to overstimulate anything that's going on in the body. High or low blood pressure, so that would be more common with an adult, but it does occur in children as well. Acute or serious illness, so a sudden illness that comes on your child, or if they have a serious illness, a reflexologist would always advise that you get prior consent from your GP or your consultant, okay? If your child has had a blood clot or any recent surgery or an operation, again, we need to give the body time to heal, and then we can go in with support. Don't forget that reflexology is a complementary therapy. It's a complementary therapy to Western medicine. And it is very important to say that reflexology is never a substitute for medical care. If you're ever worried about a baby or a child, you need to go to a doctor, consult with a doctor or with a public health nurse. Reflexology isn't a substitute for that, okay? It's a lovely support that we can do, but it's not a substitute. If your child has had a recent vaccination, it's important to wait 24 to about 48 hours after that to begin the reflexology, okay? Because as we know, sometimes children can get a fever, and we don't want to be working when there's a fever in the body. And if you're ever in doubt, just ask your doctor, okay? So let's talk about how long we should be doing the treatment for. This is an estimated guideline. This isn't a golden rule. This is just an estimation. So think about what is the age of the child that you're going to be working on with this routine. So if you have a premature or a sick baby, you're looking at 1 to 2 minutes, okay? And really for a premature sick baby, we're not going to be really going in on the reflex points. What we'd really be doing there is just the simple hold of the foot for a sick child or a premature baby. So a really good one, if you do have a sick child at home and you just feel you don't want to stimulate anything with reflexology, you just want to help to relax the child and ground the child, a really nice one is just to simply just hold their feet and covering the entire foot with your hand, okay? Because when we do this, don't forget, our entire body is mapped onto the foot. So when we're actually holding the foot like this, we're holding the body, we're hugging the body. So that's very calming and very reassuring for a sick child or for a little premature baby, okay? So 0 to 18 months there, so newborn up to about 18 months, you're looking at anywhere from 5 to 20 minutes, okay? But again, this is just a guideline. I would say my little boy is 14 months. I probably do about 5 to 10 minutes on him at night time. So really it depends on the child, it depends on their health, it depends on their form, and of course it depends on their age as well, how long you're going to do it for. So 18 months to 3 years, about 20 to 25 minutes. So my little girl is 3 years old. I'd probably be able to do about 15, 20 minutes on her, and even a little bit longer sometimes. 4 to 11 years, then 25, 30 minutes. But again, this is completely dependent on the child. So we want to also, when we're working with a child who can actually talk back to us, we want to make sure that we're asking for permission before we do this and that we're checking in with them, okay? For a child then that's 12 plus, we're looking up to 45 minutes, okay? So pretty much the same as a treatment for an adult there, okay? So just have a think about what's the age of the child that you're going to be working on. This is a guideline. And again, I'm going to send Linda on some information that she'll email out to everybody, and this will be on it, okay? So you can refer back to this. So let's talk about when we should do reflexology on a child. We want to make sure that they're alert and that they're engaged. And that really is more so for a baby. So we want to make sure that they're alert and they're engaged. They can focus on us and they can maybe hold an object and they're happy. And they're very relaxed. They have relaxed breathing. Okay. So they're not upset. They're not angry. They're relaxed. They're happy. Okay. As I said, it's always important to ask the child for permission before we begin the treatment, just to check in with them. Is it okay if I do this? Does this feel okay? And especially with a toddler or a child, we don't want to tickle the feet. So it's good to check in on the pressure. Does that feel okay? Is that sore? Is that a bit tickly? Good to just check in with them and see, making them a part of it as well. Okay, that's really important with children. Keeping eye contact with them and watching for their cues. Watching, look at their face. Did that hurt when you pressed on that reflexology point? Did their body kind of go like this? Was it a bit tickly? Did they move? So just making sure that you're watching the child's cues there, okay? And if a child is in any discomfort at all, or if they pull their foot away from you, stop. Okay, we're going to stop and then we can go back to it another time. Now, I will say, if this is the first time that you're going to be doing it, this is a new touch for them. So, they might pull their foot away. And if you're working with a child that you can talk to and you can say, are you okay for me to continue? Then do that, because it is normal for them at the first time to kind of maybe pull away a little bit. And also with the toes, they might scrunch up their toes when you're working on the toes. And so what you want to do there is just on the front of the foot is just to gently rub up and down here like this, just gently rub up and down, and you'll find the toes open back up. Okay, they just open back up. It's a new touch for them. So when you're pressing on the toes and we're working the toes, they might scrunch them up. So we're just going to rub up and down here. Okay. Hope everyone is okay with all of that. So this is the routine that we're going to learn. There's 10 steps in the routine. I'm going to talk you through this, and I'm going to demonstrate it for you. So we're going to start with a grounding technique that's just for ourselves, okay? And we're going to do what I was saying there too, just holding the foot. So we call that cupping or cradling. It's just holding the foot. We're going to look at the solar plexus, which is the network of nerves that sit on our diaphragm. Okay, so we're going to look at the solar plexus. We're going to look at the toes, because we've lots in the toes, especially for children. Having a little look then at the pineal gland as well, and how we're going to work that. The spinal reflex, really important. We're going to finish then with the ankle bones, doing some nice circles on those. A lovely grounding technique. There's 2 different ones. I'll show you those. And again, holding the feet and the solar plexus to end. Okay, so we'll go through that in a minute. Okay, I'll go through the whole routine with you. I just want to talk a little bit about the central nervous system, okay, because that's primarily what we're going to be working on today. So whether it's the central nervous system or the peripheral nervous system, which will be the solar plexus, that's what we're doing. We're working our central nervous system. So we want to make sure that we're doing very slow technique, very light technique. We don't want to be going in hard on any of the reflex points, just light touch, very calming. And just to explain to you maybe a little bit about the pressure that you should use. If you take your hand and you hold it in front of you and you press down with your fingers, just starting at your index finger, your middle finger, your ring finger, it's the ring finger pressure that you want. Okay, and even half that again. Okay, so very, very light pressure. Our ring finger is our weakest finger. So the pressure there would be very light on that touch. So that pressure, or even lighter again, if you're working with a younger, maybe toddler or baby, just very light. And for anyone that's familiar with reflexology, you'll know that a reflexologist uses a technique called the caterpillar with their thumb, where they go up and down like this with their thumb. We're not going to be doing that on babies or children. We're just literally going to be holding, pressing, and gliding like this, okay, with our thumb. So we're not going to be going in on any of the reflexology points very hard. The reason for that is we don't need to, okay, because babies and children, because they're pretty much brand new, okay, especially with a baby, they're brand new. So unlike us, they don't have all these stored up imbalances in the body where sometimes a reflexologist might need to get in and work that reflex. So they're very sensitive to reflexology and they can respond, instantly to reflexology. So for example, when my baby, my second baby George, when he was newborn, he suffered with constipation, as a lot of little babies do. Their digestive systems are just learning how to work, and there has to be that connection between the brain and the gut and the digestive system. Okay, so that's just figuring itself out when the baby is born. And so sometimes babies can suffer with constipation. And it's also common in children and adults, of course, as well. From a holistic point, it sometimes means that maybe we're holding on to something emotionally that we're not ready to let go of, maybe a fear that's there, if there's no medical reason behind it. But for a child or for a baby, if they're suffering with constipation and you work the digestive system on the reflex points, it can work instantly. And when I used to do it on my little baby when he had constipation, I remember my husband would be feeding him, and those early days when you're thinking, did they even do a nappy today? And he would say, no, he hasn't done one. And he would literally just hand him over to me. I would do it. And as I was doing it, he would fill his nappy. And I just remember my husband nearly falling off the bed in shock, like he could not believe it. Like it's just instant because they're brand new, and like I said, they don't have any of those stored up imbalances in the body like we do when we go for our self-care treatment, whatever that is. Sometimes it can hit us like a ton of bricks afterwards because there's so much going on emotionally, physically, mentally in the body. Okay, so the nervous system is really what we're going to be working on here. Our central nervous system is our brain and our spinal cord. Okay, and the brain for reflexology is here in the big toe, and our cranial nerves are in all of the toes here. Okay, so the brain is really the primary point is the big toe, but it's also on all of our toes. Okay, on all the toes, and that's where our cranial nerves are as well. So when we're working these, we're working our central nervous system. When we work the spine, we're working our central nervous system. So we want to do that very calm, very gentle, and just always very light touch. Okay, and it's important to find that touch with the reflexology that's just in between light touch and tickling. You don't want to tickle the feet either because that just won't be comfortable for the child. Okay, so let's just have a little think about here, what are the effects of reflexology on the central nervous system. So the first thing is it helps to soothe pain, and endorphins are released into the body. Okay, so that's really amazing when we think about the work that we can do just by working those points, just even the brain and the spine. So we're helping to soothe any pain that's in the body, because all our nerves feel pain. If there's pain in your body, it's in your central nervous system. It's in the nerves. Okay. Working with the brain then affects the entire nervous system. So the central nervous system really is like telephone communications that's sending signals all throughout our body, and it affects the entire body, all the nerves in our brain, hundreds and thousands of them in the brain neurons. When we work the solar plexus, then because of where that's located, it's the central peripheral nervous system here. That's what the solar plexus is, the peripheral. Okay, and when we work that, because of where it's located on the foot, it's located close to so many organs in our abdominal area that it's really good for those organs as well. Just helps to release tension and to relax them as well. And then we're also going to be working with the sympathetic nervous system and the parasympathetic, which is our fight or flight. And then the parasympathetic is what restores our state of calm in the body. Okay. So, with all of that said, I would like to stop sharing this screen and I would like to go through the routine with you. So I'm going to just stop sharing there. Before I begin the routine, does anybody have any questions on anything that we've covered there? I know that that was a lot of information to take in, especially for anybody that might be new to reflexology. But I just wanted to give a brief overview of what it is, when we should be doing it on a child. And again, I will be sending that information. Linda will send that information on to you. So does anybody have any questions maybe before we start?